Okay, we're going to look at gastric surgery and the effects on mother and baby, the synthesized finding. In this finding, I referenced two studies. One was the Rowan Y gastric bypass increases glycemic excursions during pregnancy and postpartum, a prospective cohort study, and the impact of bariatric surgery on obesity-related infertility. Just to give you a little background, 65% of all women who undergo bariatric surgery are of childbearing age. Obesity causes many health issues for women, including infertility. When a woman does achieve pregnancy, she is at greater risk of pregnancy-related complications, many times leading to miscarriage, congenital abnormalities, and death. Gastric surgeries have been an effective way to decrease weight and overall BMI in women. Currently, there are three main types of surgery: the Rowan Y gastric bypass, the sleeve gastrectomy, and the stomach band, the first two being the most effective. These surgeries have improved fertility on women, however, with side effects. We're going to look at two of these studies to find out some of these risks and benefits. So, obesity and bariatric surgery affects the glucose levels. So, in the first one, owner Sariandan and Aslan, they found that obesity is characterized by insulin resistance and compensatory hyperinsulinemia. So obese people, particularly women, have higher glucose in their systems, which causes higher levels of insulin circulating, which can lead to insulin resistance. This affects the muscles. The hepatic and adipose tissues become resistant to insulin. However, the ovaries remain insulin sensitive and exposed to the effects. Further, in the body, the fat in women affects the function of the hypothalamus, the pituitary ovarian axis, by means of the central and peripheral mechanisms. So, in obese women, there is a correlation to the BMI and obesity affecting fertility because of the effects on the hypothalamus, pituitary, and the ovaries. In this study, the mean pre-surgery BMI was 45, post-surgery was 28. And out of these women, conception occurred in 91% of the participants, and 65% of them went on to have live births. In the second study, the Rowan Y gastric bypass increased the glycemic excursions during pregnancy. In this study, we see the effects of sugar after the surgery. So here you have women who were post or pre-surgery 45 average mean BMI, and then afterward they were about 32. This was an 82% loss of the excess body weight. The surgery affected women's glucose levels after surgery, and that they created more hypoglycemia, known as post-bariatric hypoglycemia. So in the first study, we see that obesity and the high BMI, there was high glucose levels, high insulin resistance in their bodies, which stopped them from becoming pregnant. And afterward, we see that now their glucose levels have gone the complete reverse into a hypoglycemic state. This reversal of glucose and insulin exchange could be the reason why fertility occurred in once infertile women, obese women. Women treated with the Rowan Y who gave birth to, however, they gave birth to small first gestational age neonates, spent slightly increased time in both low and very low ranges. So both studies talk about the effects of sugar in the body, particularly women who are of childbearing ages. So you have to look and see, okay, women were able to get pregnant after lowering their BMI and losing the weight. However, there was a risk to the baby for becoming smaller for gestational size just because of the hypoglycemia. So improved chances of conceiving after bariatric surgery are better um, because of the hormone balances that took place. It does improve fertility. It lowers the maternal complication rates. Um, and it also lowers gestational diabetes, which I will talk about that in another paper next time. Um, but it does have some risk, and particularly the main risk is going to be to the baby. But for the mother, she's doing well and has less risk than if she was obese and had a higher BMI. Thank you.